Hi everyone, we'll start with nursing assessment. Today I'm going to focus more on the WETFLAG. So that's the best mnemonic for an ITU setting, especially in a pediatric ITU settings. So that's a vital thing we have to do for the first thing in the when we start the shift. So I'll go into the WETFLAG. So actually the WETFLAG stands for the weight, energy, tube size, fluids, lorazepam, adrenaline and the glucose. That's what the WETFLAG means. And the weight. So as an emergency, when we get a child into an ITU, the parents might not be aware about the updated weight or the current weight of a child. So at that time, we are actually we don't have any other choice to get the weight, isn't it? So that we have a standardized formula to calculate the weight of the child according to the age. So that's what here. So age plus 4 times 2. So that's the weight, and the most of the calculations are depending upon the weight. So even though we get that weight, we have to discuss with the doctors and then we have to confirm, okay, we can go with this weight or not. Sometimes child look undernourished for that age as well, or overnourished for that age as well, but mostly we take this formula and we take the value what we are getting after this calculation. And the next one is energy. So here energy is 4 joules per kg. So according to this, what weight we are getting, so we do a calculation as 4 joules per kg. That's what energy. And then is tube size. So for the endotracheal tubes, so mostly in the pediatric ITU, most of the children will be tubed with an endotracheal tube. So for preparing an intubation, or even though if they are intubated, it's always good to keep an appropriate size of an endotracheal tube next to the bed, or upsize and downsize tubes. So when we do this calculation, we will get the appropriate size of endotracheal tube we have to use for this age group. And then if we get a 5.5 tube, we try to keep 5.5 size tube and a 6 size tube at the bedside. It's for just an safety, because sometimes when we do the calculation also, sometimes some children might fix a 5 size or a 5.5 and a 6 size as well. So we always tend to keep these 3 sizes, upsize and downsize, and the appropriate size at the bedside. And the length of oral and nasal tube. So when they intubate a child, there's a calculation as well to find out what centimeter the tube should be taped, if it's an oral tube and if it's a nasal tube. So this is a calculation to estimate the length. At the final result, the final decision will be made after chest x-ray, what length is the tube sitting and everything. But then we have a calculation to do that, because while we do intubation, we don't know, we trust this formula and then we will go for it. And then after doing the chest x-ray, we will, if we have to pull it down or push it down, we will do that. So length for an oral endotracheal tube is age divided by 2 plus 12. So that's when we get a value, that's the centimeter we usually tape the oral tube at. And the nasal tube, age divided by 2 plus 15. So when we get a value for that calculation, we try to tape that centimeter at the nostrils. And then fluids. 5 mils per kg and 10 mils per kg. I wrote 5 mils per kg and 10 mils per kg here, but actually the standardized formula is 10 mils per kg. But I wrote the 5 mils per kg here. It's because we might get a cardiac child as well. So it's always good to start with a 5 mils per kg, because in a cardiac child, if we go for a 10 mils per kg, we might overflow, or we give more fluid volume to that child. So instead of to prevent a hypovolemia, we tend to start with 5 mils per kg, so to prevent the fluid overload. Otherwise, mostly if a sepsis child or anyone with a hypovolemia, we go for 10 mils per kg. And as per the guidelines, it says 10 mils, we start with the 10 mils per kg, and then we have to reassess the child, and then if needed we can go for one more 10 ml per kg as per the decision, and then reassess. And if the medical team thinks that the child need more 10 ml per kg, we can go for it, but only 3 times we can go for 10 ml per kg. After the third attempt, we have to wait until we go for another inotropes or something, but I'll go deep into all those things. But now 10 ml per kg is the standardized formula to calculate the fluids. And then lorazepam. Lorazepam is 0.1 milligram per kg. So that's I just made a calculation. If it's a 5-year-old, when we do the calculations, it might be like we might get 18 kgs. So it's just 1.8 milligrams. And then adrenaline is 0.1 mils per kg, and we use 1:10,000 strength adrenaline to do during the emergency situations. So we tend to give 0.1 mils per kg from a 1:10,000 concentration of adrenaline. And glucose. If a child with hypoglycemia, we have to go for 2 mils per kg of 10% dextrose. That's the glucose bolus we use to treat hypoglycemia, and we use a calculation of 2 mils per kg. And I've already spoke about the fluids. The ideal fluids we use here is isotonic solutions. That's the best solution. That's the only solution we have to use during the resuscitations and emergency situations, such as 0.9% sodium chloride or a plasmolite. So those two are some of the fluids we use mostly. So these are the calculations mostly we do at the start of the shift. If you do this wet flag at the start of your shift, you will be safe. Even if there's an emergency happen, this is actually quick. You can do whatever if you have this calculation at your hands. So here I've written up an example to how to do the wet flag, so it will be easy for you to do in a daily practice as well. So I've taken a 5-year-old child here to do this wet flag. So according to a 5-year-old child, so the weight calculation, if we use this formula, it will be 18 kilograms. And then the energy. So we need a weight to calculate this energy. At the same time, I have to tell you something, that we get 18 kilograms when we do this weight for a 5-year-old. At the same time, you have to confirm with the doctors, with the medical team, because sometimes the children might look undernourished or overnourished for that age group. So we have to think about that as well. But the ideal weight estimation formula for those age group is this. So for 5-year-old, it will be 18 kilograms. And then the energy. So energy is, we calculate according to the weight. So 4 times 18 will be 72 joules. And then tube size. So tube size is age divided by 4 plus 4. So when you take a 5-year-old and do the calculation, it will be 5.25. So I told already that if we get a 5.25 tube size, we might not have a 5.25 tubes basically. So we have to get up size and down size and approximate size. So we don't have an approximate size, so we go for a 5 size and 4.5 and a 6 size. So 4.5, 5 and 5.5 size tube. Up size and down size of this measurement. And then length where we tape. So oral, if it's for an oral endotracheal tube, if you do for this calculation, you will get 4.5 centimeter to tape at the lips. And then for the nasal endotracheal tube, when you do this calculation, you will get 17.5 centimeter to tape at the nostrils. And then the fluids. So there's 5 mils per kg and 10 mils per kg. So 5 times the weight is 90 milliliters. And then 10 mils per kg, so that means 10 times 18 is 180 mils. And then the lorazepam. So lorazepam here 0.1 milligram per the body weight, so 1.8 milligrams. And then adrenaline 0.1 mils of body weight, so we have to choose 1:10,000 strength adrenaline, then you will get 1.8 mL of this concentration. And then glucose, so 2 mL per kg, so that means 2 times the body weight is 36 mL of 10% dextrose. So this is how we do WETFLAG. So you can also practice on a different age groups and practice more, then you will be confident enough and then quick enough to do at a busiest environment, busiest setting as well. Even though if you are busy with a busy patient, just try to do this because it makes easier. If there's an emergency or something happens, it's always handy to use these measurements. At that time, we don't get time to calculate all those things. So it's always good to do this calculation. So I hope you understood this topic. So if you have any clarifications, you can always contact me, comment it, or I'll pin my contact details, so you can always contact me for more further clarifications as well. So hope you understood and this topic was helpful for you as well. Thank you.